real quick classification of bone tumors. Okay, WHO. Number one, main character, bone. So that is osteogenic tumors. Second character in the story, cartilage. So cartilaginous tumor. Third character of the story, that's class 3, is fibrogenic. And then you just add histiocytic. So 4 will be fibrohistiocytic. And then 5, the nerves. So it's gonna be neuroectodermal. Okay, yeah. And then 6 is for blood, hematopoietic. Okay, and then 7. You remember? I don't know if you remember the rhino, the giant cell. 7. Okay, 7 is a giant cell tumor. And then we have 8. 8 is notochordal tumors like chordoma. And then 9, of course, vascular, I mean blood vessels. Before we go to miscellaneous, that is class 10. And then anything classification, we have benign and malignant. Under benign, we have 1 or latent, 2 or active, 3 or aggressive. Here we use Arabic numbers. And active, okay, this is latent, okay, and this plastic is active, okay. So remember 5 important points, okay. GCM, cortex and reactive bone, okay. So for G is growth, okay, and C is capsule, M is margin, reactive bone, and cortex, okay. So what about growth? So in latent, glass cannot grow, so no growth, and it heals spontaneously, okay. But this plastic, it is progressive growth, okay, active growth, okay. And then GC, C is capsule, of course, intracapsular, and this one also intracapsular, okay. Those class 1 and 2. And then GCM, M is the margins, of course, both of them, that is class 1 and 2, they have a well-defined margins, as you can see. And then we have the cortical bone. So this one, the reactive bone. Sorry, I said cortical bone, it's reactive bone. As you can see, the latent one has a thick reactive bone, and the plastic one has a thin reactive bone, okay? And then we go to the cortex. So for the glass, it cannot expand, so not expansive, okay? And for the active one, the class 2, it is expansive, okay? And then lastly, in benign, that is class 3, of course, that is aggressive. And when you say aggressive, what does that mean? Rapid growth and no limitations, no barrier limitations, and it's extracapsular. Example is giant cell tumor. And then, of course, benign and malignant, both we have A and B. That's A intracompartmental, B extracompartmental. So we have 1A, 1B, 2A, 2B, 3A, 3B. Then in malignant, so we have class 1, 2, 3. 1 is low grade, less than 25% chance of metastasis. 2, we have high grade, that's more than 25% chance of metastasis. And 3, sorry for closing my eyes, I'm very sleepy. 3 is already metastasized.